So they reformatted my computer, and now my like screen 1 is really my screen 2, and screen 2 is screen 1. Let's see what happens when I do this. What does everybody see?
We see presentation mode, so we see your next slide.
Okay.
But we do see the actual slide as well.
There is a way to change your monitors back to determine which one shows as your main one, but I'm going to have to go look at it, and then I can put the instructions in the chat box for you if that would help you later.
I think I got it. Give me 1 second. You can put it in the chat box if I don't have it. But
that looks good.
Yes, now we have the slots and not the presenter view.
It is in your presenter view, there's a display settings, and it just says switch the views. So in case anybody needs that in the future. All right, so I am here today to talk about maintaining professionalism. I've given this talk before, and initially I was like, I don't even know what this means. And so I have kind of my thoughts on what this topic means, but I would love for it to be a discussion. We had a really great discussion last month when I didn't have my PowerPoint. And so hopefully we can, even with PowerPoint, have a really good discussion today. And so some questions that I think we will talk about today is, what is it? What is professionalism? How do we teach professionalism? Because many of us on this call are teaching in some capacity to others. And how do we maintain our own professionalism? Okay, so I want to start with everybody's thoughts on what is professionalism. I'm getting really good at sitting through silence.
To me, I think of like the basics. So like, thank you, you're welcome, like mannerisms, I guess.
Okay, so kind of the way you present yourself.
Well, I was about ready to say, in the sense of your how you dress, being professional.
What about dress suggests the level of professionalism?
Well, it depends on the environment you're in. You know, when I came from corrections, you know, women weren't really encouraged to wear makeup or do your hair or to wear perfume or to wear jewelry. So like that was a different to adjust to when I started working up in that area or in that environment. So it just depends. You know, I've also been in community clinics where, you know, I've seen colleagues have complaints about wearing too short of a skirt, you know. So I just feel like there should be whatever the business sets. It's usually a policy that is around it that usually dictates what the company prefers or how they want to be presented. Usually, you know, like no string tank tops or, you know, stuff like that.
Mariah, I am with you on that. I always tell trainees that from my time in corrections, I learned to wear boat neck tops or turtlenecks or very high tops. I've learned to always wear pants because I was trained in the Federal Bureau of Prisons that you don't want to make it easy to be raped.
Right.
Was put as awful as that. So yes, and I think that there's a very big difference between what is appropriate at Chestnut Ridge Center. I mean, I can wear a dress, I can and be professional, whereas if I'm in corrections, I'm going to dress very differently.
Now, another golden rule too was especially not to wear open-toed shoes, because when you were doing rounds, we're checking on the mental stability down in the queues and segregation. Oftentimes you would have urine thrown at you underneath the door. So it was always advised never, or to the women. And also too, they would tell us like some inmates had foot fetish or feet fetish. So they would encourage women not to expose their feet. Like it was bizarre, you know what I mean? So, but yeah, that's very selective population. So
I also tend to wear shirts or sweaters a lot that cover my butt. And that was a suggestion just to look.
Everyone joked
feminine.
around and called me because I was fresh out of college when I worked up there. So everyone was like, oh, look at Mariah's grandma sweaters. I wore grandma sweaters pretty much all the time. And yeah, it was to just close my body a little bit. So
Yeah, no heels. Yes, corrections is a very unique environment. How about other thoughts? So we've talked about a little bit of how you carry yourself, either the words that you say and kind of that your greetings and kind of social niceties, and then dress. What else? What else falls under professionalism? Oh, I see we're getting chats.
It's just me.
Oh, it's just Elizabeth. Well, I cannot get the chats to pull up at all, so
I can read them out for you, Dr. Willard, if you'd like.
yes, please.
So Elizabeth was mentioning like Olivia Pope outfits from Scandal when we were talking about the outfits. Totally agree on that. And then
Do you remember when New York and Company had a whole line of Olivia Pope clothes? I got one of her
Yes.
like jackets, and then I was like, you know what? Really pretty jackets are totally pointless in the real world because you just take your jacket off when you get to work. But
Anastasia Googled Olivia Pope, love her style. And Elizabeth mentioned common courtesy and respect as well.
great. Yep. Common
I think
courtesy.
community service would be part of that too, how you connect with clients or people who visit your office. I mean, you want to have a certain way of making sure that you meet their needs, but not necessarily be, oh, shucks, kind of thing either. I guess there's a fine line middle.
Yeah, it's kind of talking so people can understand, but also being, not condescending. Make sure that we're respectful to people we talk to. Anyone else?
Yeah, I think that's good. I think everyone has good answers. Like just respecting other people's culture, backgrounds, knowing when like conversation should probably not continue. I think sometimes it depends on how close you are to people, but politics sometimes not a good thing to open up religion. I think just kind of keeping it business and about work and, personal things if you're close enough to people. But I think sometimes you gotta be careful of that line, especially I'm very much open book, so I have a hard time with that too. And I want everybody else to be as open-minded, but sometimes it's not the case. So I think recognizing those social cues from people.
Yeah, I think it's easier to think about what is not professional than it is to think about what is professional. And so I think sometimes that's an easier question to answer. Some other areas that come to my mind when it comes to professionalism, and this is kind of more in our, most of us in the call have some sort of, post-high school education, mental health providers in some way, shape, or form. And so I think that ethics to me talks about professionalism, right? So that ethics falls into play here. Competencies that you have or don't have falls into play here. And the way that you carry yourself, your dress, your approach to patients, your words, and your actions all falls under professionalism, which is why this topic is much bigger than we have time to fully cover today. I'm going to skip that one. So these were just some of the areas that I came up with as topics of discussion under the context of this maintaining professionalism. And so questions that came up for me is, how do we teach professionalism? Can we teach professionalism? So, as a psychologist, we've got graduate students, we've got interns who are almost ready to be in the field. We train postdoctoral fellows, we train psychiatry residents. How do we teach them to be professional? What does that mean? Is there any difference between professionalism with telemedicine than there is professionalism in person? That's something we've probably all had to kind of deal with within COVID. How do we regain professionalism? Because this topic initially was maintaining professionalism. That would mean that you had professionalism, and then you've lost it, or you have professionalism and you have to keep it up, that it's not a static thing, it's ever kind of in flux. Is self-care a piece of professionalism? What happens when a provider lacks professionalism? And lastly, how did or do we become professionals? How do we know that we've reached it? We have professionalism. So these are the topics that we're going to go through today. And please, everybody, stop me, ask questions, put your story, tell me your stories about people who are professional, who are not professional. I wanted to start by defining professionalism, and then at the end, we'll end by talking about kind of maintaining or treating professionalism. So how do we actually define this term? Throughout this presentation, you'll see the term doctors. Doctors is an all-inclusive healthcare professional title for us today. So the way that I would like to define clinical professionalism for today's lecture is that it's a set of values, behaviors, and relationships that underpin the trust the public has in mental health or in healthcare professionals. There are kind of 6 domains that kind of broke down into like 3 areas. There's a social area, an ethical area, and a legal area, but there's really 6 domains. So professionalism includes having an ethical practice. It includes reflection and self-awareness. This is kind of about how do we maintain it? We have to reflect. We have to have self-awareness of where we're at this moment to make sure that we're maintaining our professionalism. It's taking responsibility and accountability for one's actions. It's respect for our patients. It's respect for our colleagues. It's respect for our trainees. It's working well with others, and teamwork is professionalism. It's also social responsibility. And this one I think is really interesting, given kind of the advocacy and the kind of big social issues that we have been, that the US has been coping with over the last couple of years. Okay, this one's a little bit hard to see, so hang in there with me. This all comes from, and this presentation comes from this citation down at the bottom. It looked at medical professionalism and kind of what does the public think. So this is kind of looking at clinicianship, which I never thought of as a term, citizenship, and worksmanship, all within clinical professionalism, which is kind of interesting. As a psychologist, I don't remember having any kind of courses that tried to teach me about professionalism, but it seems like that may be something that is taught in medicine. I don't know if anybody has thoughts on that. Anybody have a class that helped them learn how to be a professional?
In my junior college courses, I had a teacher who included that, but it was not a subject per se.
I was a smart teacher. Yeah, I think sometimes we make an assumption that everybody just knows what professionalism is. But like we talked about earlier, when Mariah started in corrections, she probably had no idea these were the rules that you should follow. This is how you should dress. And I remember multiple times I've taken jobs, and that first day I'm like, what am I supposed to wear? How dressy am I supposed to be? How casual can I be? It's always a difficult, even just the dress is difficult to kind of figure out between places. So let's kind of work our way through this Venn diagram. We've got clinicianship, workmanship, and citizenship. So let's look at the big ones first. Let's talk about clinicianship and what they mean here. So this is the way that you kind of communicate and treat patients or individuals that you're working with. So this is talking about respecting the client's autonomy, communicating in a clear and effective manner, showing altruism towards patients, which is kind of an interesting thought. I know there's some controversy over whether altruism actually exists, but I think it's kind of that do no harm towards our patients, being attentive to the needs of patients, treating them fairly without prejudice, being empathetic when caring for them. And then we have, so that's one aspect of professionalism as healthcare providers that we've got to learn. And some of that, I think, has been taught as we're growing up and has been taught over time. That one probably is less something that your supervisor is going to need to teach everyone unless there's an issue with professionalism. Then we have worksmanship. So this is acting in a responsible fashion towards colleagues, acting responsibly towards society, holding a positive attitude towards one's own personal development, working well as a member of a team, being attentive to needs of colleagues, being aware of one's own limitations as a practitioner. That one can get in people's way sometimes. Being adaptable to change, treating other professionals fairly without prejudice, treating colleagues fairly without prejudice, not using your status for personal gain, being sensitive to the cultural background, showing leadership skills and initiatives, looking after one's own health and well-being, being accessible to colleagues. So clinicianship is about how you treat your patients. Worksmanship is really about how you treat your colleagues, those that you are working around. And then having skills to train colleagues is that last one. And then in the bottom, we have citizenship. So this is like being a good person. And so that's taking care of ourselves in terms of substances, alcohol misuse. This is where that self-reflection, self-awareness comes into play. Do we know if or when substances become an issue? Adhering to professional rules and regulations, that's where kind of ethical codes come into play. And then a functioning according to the law. So not engaging in illegal behavior. And so then they kind of start combining some of these. And so it's both about respecting patients and respecting colleagues, working with colleagues towards common goals, providing advice to patients and colleagues when it's required, avoiding a cynical approach to one's job. I think that's one where I may fall prey to unprofessionalism sometimes. That's a tough one for me. It's being accessible to those around you. Now, clinicianship and here we got clinicianship and citizenship. This is, keeping confidentiality, right? Because this is your ethics, but it's not just your ethics for yourself, it's your ethics as it involves patients. So it's ethics in confidentiality and privacy, being responsible, using sound judgment and decision-making, behaving honestly and with integrity. And then we have over here, has good citizenship fits in with good workmanship, and they noted just being punctual. And lastly, this is all three. So when all three of those come together, it is acting with confidence in one's duties. I think appropriate confidence. So this isn't overconfidence, not realizing where your limitations lie, but this is appropriate confidence. Behaving reliably and dependably, behaving with composure, being accountable for one's actions, and taking a dedicated approach to one's work. Okay, so that's kind of how we define professionalism. And the one that I find really interesting, I can think off the top of my head, professional behaviors, professional language, professional dress, like that all comes to mind. When I was trying to define professionalism initially, before I got into the literature, I didn't think about values as much, not personal values. I can see where that's important, but professional values, and how in order to teach professionalism, we're teaching it by helping trainees around us understand what does it mean to be X type of healthcare provider. What does it mean to be a physician? What does it mean to be a psychologist? What does it mean to be a counselor? What does it mean to be a therapist? What does it mean to be a social worker? And so there's no consensus on how to teach professionalism. But the key, and this is what we are all doing with individuals, is we're socializing them into clinical and professional settings. And we do this with all of their different practicums, externships, internships. We are modeling for them what it means to be a professional in psychology, what it means to be a professional in each of our different fields. We're teaching them how to develop communication skills. I would venture to guess many of us, prior to starting training in our fields, didn't know the key terms that we use that suggest that we're professionals. We all had to learn the ways to communicate, the word choices that we use, the way that we ask questions. And so with these hands-on learning and the internships, externships, we're teaching them communication skills. We're teaching them collaboration, respect, teamwork, and the ability to maintain professional boundaries, which means that when we're training someone and we're teaching them about professionalism, we have to be pretty clear and pretty good at being professional ourselves, because our behaviors and what they're seeing is what they're going to take with them to be, how do I become a psychologist? And everyone kind of comes into that professional training with their own personal values, but in training, we're teaching them professional values, attitudes, behaviors, language. We do this with formal and informal observation of others, and the trainees are doing this by formally observing other people conducting therapy or assessment, or informally just kind of watching how the supervisor interacts with a patient or a patient's family. We do this with demonstrations, and we do this by assigning tasks in a developmentally appropriate way. And so when we're supervising a trainee, say it's a first-year graduate student, we're not going to take our most difficult patient, say, you're going to provide therapy today, go. No, we're going to kind of start where they are and slowly give them more autonomy and more complexity in care, as we see them acting in a professional manner and having competencies. So this one kind of piggybacks off that last point, that everyone comes into professional training with their own values. And so this looks at kind of professional behaviors, professional cognition, and also kind of our authenticity. So this one is kind of the overview here. So what the person does, what they show, that they know how, and that they know. So really we're starting at the bottom, right? Can they fact gather how to be a professional? Do they know, do you wear this or this? You know that they wear that. And then you're training people to know how to do something, right? So you're teaching them to know how to diagnose autism, maybe. And that's different, right? Maybe they know the facts about autism. That's the know. But know how do I evaluate autism in an individual? Well, they may see that through case presentations, writing different kinds of essays. The next is that they need to show through maybe a simulator. And so that could be with like a standardized patient. They might practice how to assess that skill. And then lastly, they're going to do that skill. And they're going to do that skill under observation where they can be provided with feedback. And so it starts by kind of learn those basics. This is where you're getting your education. Maybe we'll do some coursework before we start putting people into professional settings. And then once they're 2 years into their program, then maybe you have them do an internship or an externship where they can start observing and actually conducting these skills. So I thought this was an interesting picture. And this is a basket, they call it the basket of professional qualities. And so this talks about that beginning is the things that people come in with prior to training. They come in with their own understanding and own judgments. They come in with their own level of excellence, moral contract they kind of have within themselves. And then once they're in a training environment, that's where we teach knowledge, the clinical skills, commitment, mutual respect, integrity, compassion, all these things. And then what comes out of all of that, that's professionalism. That's when people have mastery. That's when they have autonomy, they're given autonomy. They have the privilege, they can self-regulate themselves. But you know, we got to remember they're coming in with something before us. We're teaching them all of these skills in order to hope that the field in the future moves forward. Okay, so we've defined professionalism. We talked about how we teach professionalism. Next, we have how do we assess professionalism? And so this one is helpful to me because it's kind of like a checklist. So if you are kind of struggling with, well, how do I know if the person I'm supervising has good professionalism? Well, these are some things that I could check off on a list, right? Do they show up to the lectures that they're supposed to? Are they punctual? Do they sign in and out of sessions like they're supposed to? Do they give notification to supervisors if they're absent? Do they attend the agreed upon meetings? Do they give prior notice if they have to be somewhere else? So that's just basic kind of attendance. This is all that, like in the very beginning when you're trying to hire someone. Do they submit the right information? Do they bring the right required IDs? What is their criminal background check like? Immunization record up to date? And then other assessment data we can use to assess professionalism is, do they submit their assignments on time? Do they complete and collect the information that they're supposed to? Do they comply with all of the requirements? Are they logging their hours appropriately? Are they kind of fudging hours or blatantly making them up? Are they attending sessions that they're supposed to with administration? Have they collected the right course materials? Are they accessing the learning environment? This would be more if you were kind of teaching like kind of maybe the basics of like a medical student lecture. And do they complete evaluations? Do they respond to polls? Okay, I'm gonna pause. Thoughts, things that are missing that you think are important to teaching professionalism? So for me, this learning more about maintaining professionalism is when I realized at some point in graduate school, I started to think like a psychologist. And I don't exactly know when that happened, but sometime, and I would venture to guess it's probably after I'd done some clinical work. It might have even been close to the end, like heading towards internship, when I could say, all right, I have the values that I believe a psychologist should. I view myself as a psychologist. No one has anything. So maintaining professionalism. This is a piece that I joked with Sherelle at the beginning that she could teach, because Sherelle gives a wonderful talk about burnout and how to avoid it and self-care. And that's what we're going to get into with maintaining professionalism. Okay, so how do we maintain it? So we're going to assume everyone here has good professionalism. But the important thing to keep in mind that it's not a one-time thing. This isn't some checkbox at the end of training that says I'm a professional, or at the end of orientation, I'm a professional. It's something that we always have to be aware of, and sometimes we might be slipping in one area or another, and we have to kind of put ourselves back on the right track. That comes from reflecting and having a good reflective practice. It's having self-awareness when maybe things at home are really difficult and they're impacting how we're acting at work. Or things at work are really challenging and they're impacting the way we interact with our colleagues or our patients or our trainees. The other important characteristic of maintaining professionalism is something that all of you are doing right now. All of you right now are demonstrating that you're lifelong learners and that you value maintaining your competencies, because, and maybe this is required for certain people, but we have a consistent group of people that come to this lecture twice a month. And I don't imagine you'd be here if you didn't have an interest in lifelong learning. If you weren't excited about learning new things or learning how to do things better, or looking at it from a different perspective. And that's really important to maintaining professionalism. And the last is good self-care, which I know can be difficult. Thoughts on this? All right. Okay. So this is a bit about the two-bucket approach to promoting well-being. This is the idea that one side is that we have to take personal responsibility for our well-being. And on the other side, our organizations have to take responsibility to promoting the well-being of those involved in their organizations. And if we're in a leadership position, then we have to take responsibility for promoting an environment of well-being for our supervisees or colleagues. So first, under taking responsibility, just some thoughts to keep in mind. The second one is very hard for me, but we got to take vacation. We've got to take vacation where we check out completely from work and we're okay with it, which it doesn't need to be a guilt trip. I mean, the US gets very little vacation compared to other countries. We should make sure that we're taking it. Take some time off, take some time to kind of get away, reset, regroup, so that you can kind of come back and keep doing your job. It's caring for yourselves in terms of diet and exercise. It's having a support system, and it's setting time aside outside of work to do things that you enjoy. This talks about avoiding delayed gratification. So kind of always putting off rewarding yourself is not helpful. Make sure that you're rewarding yourself somewhere. As far as organizational level, it's really important that leadership in organizations is offering honest discussions. They need to create an environment where individuals feel that they can be honest and not be penalized for being honest. It needs to be an environment, this is talking really to physicians, but other medical providers. They need to be encouraged. We all need to be encouraged to talk about medical errors and treatment failures. I don't know if the Chestnut Ridge group that's here was at Grand Rounds the other day, but we had a Grand Rounds that was talking about how important it is to have the MMI, medical errors conversation. When there's a bad outcome, we have to be able to come together as a unified group, work through the root cause, figure out why this happened, what fell through the cracks, what happened, what part of the system didn't work, and take accountability to fix it, because that's the only way it gets better. We have to be careful not to be defensive when medical errors happen, and we can't shy away from having that difficult conversation. Another way an organization can promote well-being is to have self-assessments of the providers, so they can kind of gauge themselves where they at. And I think then the organization needs to be able to say, here are the services based on wherever you are in that self-assessment. And one thing that is known about promoting well-being is for an organization to develop flexible schedules. I would add in here that when we're thinking about flexible schedules, we're thinking about a combination of in-person and work from home. because that's the reality of the world we live in for most jobs. Granted, there's going to be some jobs that have to be done in person in a certain environment. But for many of our jobs, it is possible to be flexible in those schedules and flexible in where we're physically located to perform our services. And I think organizations really need to recognize that. And it's not about what's easiest for the organization, but what's best for the employees. So what are some risk factors for burnout and illness in mental health providers? This one talks about doctors, but I think it hits all of us as healthcare providers. And so these are some occupational risk factors. Clinically, it's the emotional demand of our patients. So maybe the patients are close to death, or in our line of work, patients are in despair, or they have significant disabilities. There's a high expectation that medicine can fix everybody. And clinically, they talk about the ease of access to prescription drugs. I would say the emotional demands, I know for mental health providers, this is huge. We're holding space for patients in some of their most difficult times. And that's a huge risk factor for our burnout. Structurally, we have heavy workloads and long work hours. There may be sleep deprivation. We know that in healthcare, there's systemic racism, and in most organizations, systemic racism, there's gender disparities, there's lack of cohesive teamwork. We have this great resignation, and so everyone is looking to hire, nobody has enough staff, and all of that plays into risk for burnout. Some individual characteristics that are risk factors for burnout. So they talk about the ability to compartmentalize, which I think is one of those, I like to think of this one as it's a balance, right? I think to some degree, we have to compartmentalize. I'll tell you, in my work, I know I have to compartmentalize. I have to be able to conduct an evaluation of a parent who's allegedly physically abused a child who's 4 days older than my son. I've got to put that aside. I've got to put my son somewhere in the back of my brain and focus just on the facts of the person who's talking to me in front of me. But I think that there are detriments to compartmentalization, and that's where you run into risk for burnout. I think that there are other risk factors: narcissism, perfectionism, compulsiveness. All of those seem for me to fall under this kind of self-awareness. Or kind of ability to be flexible, and how without that ability, we run the risk of burnout. There's often this excessive sense of responsibility, a desire to please, and a guilt when things are out of our control, or when we can't answer a question, or we can't fix this situation for a family. All of those are risk factors. Risk factors for burnout in healthcare providers includes barriers to seeking help. We constantly talk about the stigma of mental illness, but the stigma of mental illness is very strong within mental health, or even all healthcare providers. We're kind of our own worst enemy sometimes there. And some of it is logistical. It's a concern about confidentiality. Where does a therapist, a counselor, a social worker, a psychologist go in a small town to receive mental health treatment by somebody that they don't know, that doesn't know them, doesn't know their colleagues, doesn't know their family? That's very hard to find. There is some concerns, this is particularly with physicians, there's some concerns about disclosure of mental illness and regulations. It was my understanding that in credentialing for medicine, physicians have always been fearful that if they even note that they're taking psychiatric medication, that they will not maintain their license. I've heard of many physicians having to go to different states and pay out of pocket for medication so that the licensing board doesn't think that they are unfit to work, which is really disappointing. Psychological barriers, I think, despite us trying to break down stigma, I think there's a feeling of shame and embarrassment. Many see illness as a mark of failure, and it's difficult to take on a patient role. And then systemically, mental health, physical health, mental health treatment is underfunded. There's lots of reorganization, and healthcare is a business, which as an employer and as an employee, healthcare as a business means that we need to generate more RVUs, see more patients, find more time in our schedules, do more, see more, make more. And then as patients, sometimes that means pay more as well. So I'm going to end today with an acronym to help all of us prevent burnout. And BURNT is the acronym here. So B stands for balance of work and play. And balance is important to keep in mind that balance means that it's going to shift. It's going to shift. It's not, balance does not mean that we need to stay on a flat plane of 50-50 work life, but it's that when work becomes heavy for a little bit of time, play is going to lessen, but we've got to kind of come back too. So there are times where you have a lot of things going on for a week or a month, trying to keep in mind that that should also shift back. We've got to always kind of come back to that middle ground. So between the machinery of caring and actual caring, they're talking about decluttering the space in the consulting room between us and our patients. Understanding our limitations. We are not superheroes. R stands for recognize. This is where we should be preventing and treating burnout in ourselves, in our colleagues, in our teams. We need to nurture the next generation. That means that when we're teaching professionalism, we're teaching them self-care. We're teaching them by allowing them the space to engage in self-care and teamwork, working in groups, restoring time and spaces for work, rest, play, and reflection together. And I know, it's extra challenging to have really good teamwork when people are working remotely, but we've got to find ways to do it. And we've got to find ways that people can be in the office or at home and that they can kind of flex that schedule and still maintain that teamwork. That is the end of what I have.
Thank you so much, Dr. Lillard. I remember you doing this didactic in the past too. And every time you do it, I feel like I learned something new. Even the self-care aspect of all of this is so crucial and something I wouldn't have really thought of as part of maintaining professionalism. So thank you so much. We really appreciate you. Any questions from the group or thoughts or comments? And feel free to unmute and just chime in.
You're a quiet bunch today. I hope it's not because you're all thinking, I'm going to burn out. I'm going to burn out.
They're reviewing the acronym of BURT.
Yeah. We got a puppy in this video. See, that helped.
Cheryl, I see you unmuted there. Did you want to chime in or comment?
I'm trying, yes.
Yes, we can hear you.
Thank you. Two things I wanted to just ask you, Colleen, and just hear your thoughts and other people in the group as well. So it seems as if it's hard for people, change is hard. So organizations who have had people come in, check in, 9 to 5 and all of this. Now, okay, COVID has thrown this whole thing. And okay, yeah, listen, we realized people can do their jobs from home just as well. but there is this fight, this pushback. Okay, well, you need to come in the office. And you also said, in spite of the fact that we are working from home, yes, we still need to socialize. We still need to find our, opportunities to get together. But there is this pushback, you have to be in the office. You have to do all of these things, but, because it's so hard for people to imagine that you can actually work someplace else than your office and actually get the job done and do a fantastic job while you're doing it. So that was one thing. And, please feel free to comment on that. Okay, but you can start with that.
Yeah, I think it's really important. Sherelle and I have been in some bigger meetings where we've had a discussion. Do you remember the phrase? What was it? Was it workplace parity or something? Anyway, there was a phrase coming out that we were using to talk about this balance between work from home and work in person. And I really was hopeful, but COVID showed us, as Sherelle said, that we can do it. We can do it, and it worked okay. So I thought for sure, there's no way there's going to be a huge pushback after this, because we just showed you that it worked. And I was wrong. And I think Sherelle nailed it. I think it's change is hard. I think it's hard. I think there's a feeling of a need to control, and that there's a need to control schedules. What if I let them work from home and they don't do anything?
Right.
Or I don't know what they're doing if they're working from home. And then I don't know where it comes from. But like with that, I always think, well, then you don't trust.
Right.
You don't trust your teammates if you're worried about what they're doing every day.
Yes. Yeah. Thank you. Thank you for your comments. So that, that was the first thing. And then the second thing was, one of the last points you made about that the healthcare is a business. And so this, this struggle that we have of maintaining our sanity and our well-being, but recognizing that we're also in a system that, it's a business. So this push and pull between, like you said, you have to generate RVUs. The business has to make money. And so but it seems as if it's just, like more and more and more and more, without a recognition of that people have limits and people's emotional and psychological well-being. And, it's that what we're doing is sitting and listening for hours and hours and hours to people's pain.
Yeah, that I've been here in academic medicine for over 6 years now. And it has been kind of a creep. And people who have been here longer have told me that's kind of the way it's always been. It always feels like the business part becomes more and more about what we do. I wonder if we had like some series of universal health care. I wonder if it would be any different. And I'm sure there's research out there because there's lots of other countries that have universal health care. But would that business pressure be less when all the care is covered? I had heard that, the people with insurance have to cover all the people that the hospital has to take in that don't have insurance. And so I kind of wonder if maybe that would make a little bit less of the creep. I also hope that soon, but over time, leaders will learn that there are things that you can't just say, we'll just replace you. We'll just get somebody else to do it. That it takes more money and more time and more effort, and we lose something every time we lose a really strong employee.
Absolutely. Yeah. Yeah, I think what you just said is so important, where we feel like, okay, well, next, there are people lined up for your job. So, you can't, you want to next.
Yeah.
And like, as you just mentioned, there's just so much investment in teaching and training that you lose, not to mention the emotional impact that it has on other colleagues that, this whole community and the stability of that community and how important that is. Yeah, so it's a lot. It's a lot that goes into what we do, and it's a lot that goes into what you are talking about today. And I really appreciate you focusing on this topic today. And self-care, yes, self-care. Because if we don't take care of ourselves, how can we in turn take care of the patients and the people that we care about, and the people of West Virginia?
Absolutely. Thank you, Sherelle.
You're welcome. Thank you.
I'd love to hear some others.
Oh, sorry. Yeah.
Sorry, I would love to hear others' thoughts before we go today.
Yeah, absolutely.
I told you Sherelle always nails it.
He does. You both do.
Oh, you're so kind. Thank you, Colleen. Thank you, Mitra.
Of course. Any final comments, thoughts from the group? As always, you're welcome to email us if you do have anything to share with the group. We're happy to send it out to everyone, or in the recap email. Alrighty, well, thank you so much, Dr. Lillard. Always such a great didactic, and always love having you on the sessions as a hub member, and also just, teaching us so much. So we really appreciate you.
Thanks, Mitra.
All right. So the only announcement that I have is our next session will be on July 6th. We got a chat in from Anastasia. Thank you. Great information. So I just wanted to read that out loud for you, Dr. Lillard. So July 6th, Laura Alward will be presenting on evaluation and treatment for bariatric surgery. So we're excited to have her. Yeah, so we'll be sending out the reminder for those. Really excited to have her as a guest presenter, and we hope to see you all next time. Thanks, everyone. Take care.